Hello, everyone. Good evening, everybody. I'm Pranjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live: fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when it comes to health, but they are important and can cause serious problem if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are just not just here to talk about the problem, we are here to talk about what we can do about it. We'll look how to stop fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert, Dr. Siddhi Tiwari, live from Mumbai, to talk about prevention methods to combat fungal infections. Dr. Siddhi Tiwari is a board certified dermatologist, MD, DNB, practicing in South Mumbai. She has special area of interest in aesthetic and anti-aging medicine, and her expertise lies in performing sophisticated procedures like fillers, botox, thread lifts, lasers, chemical peels, non-surgical body contouring, like PRP, micropigmentation, and various dermosurgical procedures. Dr. Siddhi Tiwari, with nearly a decade of experience in offering world class dermatological care to all her patients suffering from skin diseases. Dr. Siddhi Tiwari has more than 8 years of experience. Dr. Siddhi completed her MBBS from dermatology in 2011. After MBBS, Dr. Siddhi Tiwari completed her MD dermatology from Sawai Man Singh Medical College in 2015. Dr. Siddhi Tiwari currently practices at Dermacare Skin Clinic and Cosmetic Center, Girgaon in Mumbai. Dr. Siddhi is truly a patient and focused dermatologist. It is a pleasure to host you today, Doctor. So, over to you. The first question would be: what are the most prevalent fungal infections in our region, and what prevention strategies do you recommend for each?
Hi, Priyanjali. Thank you so much for the introduction. Hello, everyone. My name is Dr. Siddhi, and I'm very happy to join you today here for this live session. And today we are discussing a very common and a very bothersome issue, particularly the season of summers is such, which is fungal infections. And in my private practice, I'm seeing, and in fact, every year we see a lot of cases of fungal infections, especially in a city like Mumbai, where it's very hot and at the same time humid. It is particularly a very difficult and a taxing issue. So, coming to your question, we see it very commonly in day-to-day practices. The common form is it's called as the ringworm. Normal public or the layman, they know it and the name of a ringworm because it looks like a circular ring which is red in color. But there could be various presentations of it. We'll talk during the course of the session today. Common ones are the ringworm or the fungal infection on the body. It could be on any part of your skin, but the common areas are body folds, like your armpits, under the bust area, the groin area, the buttocks area. These are the areas where there is a lot of friction because of the rubbing of the skin. And secondly, in the summers, the sweat or the heat, it gets trapped in between these body folds. And the fungus loves the hot and the humid environment that is created. And that's why it thrives most commonly in that area. So this is the commonest presentation that I see. However, it could affect any part of the body. It could be on even on the face. We call it as tinea faciae. Many a times people gets it on the palms and the soles. Athlete's foot, as you mentioned, the tinea pedis. People get a lot of nail involvement in the form of fungus infection that is called as onychomycosis or tinea unguium. Also, in children, we see very commonly that they get the fungal infection of the scalp or the hair, that is called as the tinea capitis. So, common in kids is born of the hair. It's relatively uncommon in adults. However, in adults, the most common are the flexural, the one which happens on the body folds, and the rest of the names that I mentioned. Yeah, I would like to mention one more kind of fungal infection, which is not the ringworm, but it's caused by a different set of fungus, which is called as Malassezia. That looks
Hmm.
more like multiple patches, which are of different color. So it's dark looking, scaly patches, and they are tiny mottled patches all over, usually on the chest and the back. And sometimes they are overlapping more on the neck. Again, the areas where you are prone to get more sweat. So this is another version which is less commonly known to normal people, but it is very commonly seen in private practice, and people usually tend to ignore this, or it is misdiagnosed quite a few times. So these are the
Right.
common skin fungus that we come across.
Right, right. Also, doctor, are there any specific populations that are more susceptible to fungal infections? And if so, what preventive measures should they take?
Should be taken. So, see, it can affect any age group, right, from children till the elderly. But of course, people who are more likely or more prone to get fungal infections are usually the extremes where the immunity is a little low. So, commonly in
Right.
children and in elderly, maybe they are the ones who are suffering from diabetes, or because of the age, the immunity is a little lower, or because they're on certain kinds of medications. So, people who are on immunosuppressive medications, or people who have cancer, they are undergoing chemotherapy. So these categories where the immunity is low, it is very easy for any infection to then thrive or multiply and become more strong in that situation. Also, there are
Right.
certain conditions like pregnancy where overall the immunity is a little low. So these conditions in India, however, I'm seeing that, over the counter use of these topical steroid creams. So it is a big problem that we see being dermats,
Mm-hmm.
then that people are easily, it's very easily accessible to buy those steroid creams, and for any kind of rash people are just using those creams, to name a few: betnovate, quadriderm, panderm. So these creams are available like candies, and even the pharmacist is, anybody and everybody is recommending, and they are using that. So these steroid creams, it reduces the local skin immunity, and when people
Mm-hmm.
use these creams, they are more likely to get a fungal infection. So
Right.
this is the scenario where they are more likely to get the infection. But nowadays, I'm seeing that even people with healthy bodies and good immune levels, because the infection rate is so high nowadays, that it's affecting almost everybody.
Right. Right.
Yeah.
Doctor, speaking about diabetes, are we saying that diabetic patients, for them, it takes a little longer to get cured?
Yes. So, what I'm not saying that all the people with diabetes will have it, but if I
Mm-hmm.
see an elderly with a very massive fungal infection, okay, or an infection which has been there, it's coming, going on and off, or it is following a very long course and it's there for months altogether. We usually, that's
Right.
the first question we ask, that are you a diabetic? Okay, and
Mm-hmm.
more often than not, when we get the test done, many a times we are diagnosing it. That could be a presenting condition, or many a times the patient is already undergoing medications. So yes, it's a
Right.
little difficult to treat the cause. The changes from a normal healthy person is that there is an extensive involvement, means it affects the
Right.
larger body surface area. The infection is a little more stubborn to go, so we need to continue the medicines for a little longer period of time.
Right, right.
Yeah.
Also, doctor, for the people who are suffering with fungal infection already, uh, do we ask them to avoid taking any sort of, skincare or the kind of peptides? The market is full of,
Yeah,
new
yeah,
skincare products nowadays.
right.
So, do we suggest our patients to avoid those?
Yeah, so see, this particular scenario will happen when a person has a fungal infection on the face. Okay, it is not very commonly seen, but yes, nowadays I'm seeing a lot of these scenarios. Yes, I do tell them to stop any skincare actives. See, skincare we can divide into
Mhm.
basic and actives. So basic is
Right,
your face wash or cleanser, moisturizer, and sunscreen, and then the rest
right.
of the peptides and your vitamin C and niacinamide, all that is actives. So I
Mm-hmm.
always tell my patients to continue with the basics. And then, of course, the creams that we will prescribe them, which they have to put on the
Right.
fungal patches, they are
Mm-hmm.
initially advised only to follow that bit. Okay. And because we don't know if there are some exfoliants which are there in the skincare, it may
Mm.
irritate an already irritated skin.
Right,
Okay. Because
right.
and then it may just be a little more eczematous. It may develop an eczema, or it may become more itchy, or, more flaky. So the best
Mm.
practice is just follow the routine and do the antifungal, the topical antifungal, the creams that we suggest. And once you're done through the course of treatment, then we gradually bring those actives back into the routine.
Right, right. Now,
Yeah.
doctor, coming back to the basic topic, how does one recognize that this he or she is having fungal infection? What does the first stage look like?
Okay, so usually it starts in the form of red patches. Commonly,
Mm-hmm.
people see round or oval patches on the
Mm.
body. It usually has like a rim or a border to it. It's
Mm,
itchy, it's slightly flaky. It's most
mm,
commonly on the body folds. So the common is in between the thighs, on the butt, or any red flaky circular patch on the body is what
right.
should ring a alarm that it could be possibly a fungal infection. More often than
Mm,
not, people wait and watch. If the itching or the symptoms are not too bad, they think, okay, it's a rash. They are putting random things, home
right.
remedies. They're doing all that. It never will clear out with the simple measures. So when it is more
Right.
persistent, or if you notice that now it is becoming bigger, or they are getting multiple patches, or maybe a similar
Mm-hmm.
kind of a patch is there in the other family members in the same household, then
Mm,
ideally I suggest that they should come and visit a dermatologist and get it treated, because it's important to know that it is contagious in nature. And if a single person has a fungal infection in the family, they can be the source of infection for the rest of the family members as well.
right.
So,
Right.
a correct treatment. So, first, the proper diagnosis. So, patients have to be proactive. They have to reach their doctors. The diagnosis has to be made, and the treatment has to be followed in a very strict manner without missing any of the medicines and the creams. Then it is very easy to take care and to clear the fungal infection.
Right, right. So, doctor, you mentioned it is contagious. So, what is
Yeah.
the basic hygiene routine one should maintain when he or she is suffering with fungal infection?
So basically, no sharing of the items, the personal items, with the person who is having the infection, be it the
Mm,
towels, be it soaps, or maybe any of their makeup or their sporting equipment, their gym equipments, their slippers, depending on whatever is the area involved. Like if it's more on the foot, then all the things related to the feet. If it is more on the body, so any particular item which comes in the contact with the skin of the infected person, where the rash is there particularly present, that should be avoided. They shouldn't share those particular items. Secondly, their clothes, I always tell my patient that the infected patient's clothes should be washed separately from the rest of the household. Again, the clothes have to be dried very crisp, so I always tell them that you invert the clothes, make it inside out, dry it under direct sun. And even after drying, like in the rainy season here in Bombay, it's a lot of problem that the clothes are never completely dry crisp. So we
right,
tell them that you iron the clothes on both the sides, on the inside and the outside, because again, any kind of a fabric which is still moist, and if the patient wears that, then that is again more favorable for the infection to grow. So
right,
these are the few things I always tell them: your nail cutters and your slippers, keep it separate if you are the one who has infection more on the hands and the feet. Again, the comb, if somebody has an infection on the scalp, then the combs have to be kept separate. I
mm,
also, as a general advice, tell all my patients that they should always maintain a good basic daily hygiene practice. That is, take
right,
shower at least once a day. If they are a person
mm,
who has a lot of outdoor exposure, or they are exposed to sun and they are sweating more, then ideally take shower twice a day. Say post a workout, post coming back home from office. So take shower twice a day. Make sure you have dried your skin very properly, especially the body creases, and then you apply your products which the doctor has recommended, the creams, and take the medicines on time. So basic general hygiene. As a general rule, for people who don't have fungal infection and they want to prevent getting that, I more
right,
most commonly the source is public area. So if you're going to say a clubhouse, or if you're going to a swimming pool area, or if you're going to say a gym, where you there is a higher chance you're walking bare feet, and then you are also, or maybe salons, as a matter of fact, where they are not using these disposable things. So the
right,
towels, their equipments, the gym equipments, the floor, the bathroom, equipments which are there in the swimming pool areas. So you should always carry your own things, or at least ensure that the place is clean and hygienic. In that way, you can
right,
prevent contracting a fresh infection. Okay, so
right,
these
right.
are a few things. Also, many a times, when you're going to the salons, let's talk about the salons. A lot of people are getting the manicures and the pedicure done. Sometimes some people are very enthusiastic. They are kind of getting it done repeatedly over and over again. They get a lot of
Mm-hmm.
nail filing, buffing done, and
Right,
their stylist or their attendant is always cleaning and enjoying in a way when they are digging the equipment inside the nail in order to clear the debris from under the nail.
mm,
That sometimes causes or breaks open the barrier between the skin, and that makes like a good entry point for the fungal infection. So all my
Right.
patients with fungal on the nail, I always tell them that now don't do your manicures and pedicures, because it's quite
Mm,
likely that the person, in order to clean it off, may just push it a little more inside, or maybe from one nail the same tool being used on the others can spread into the rest of the nails. Okay, so you
right.
can follow basic practice just with a separate nail cutter. Just clip your nails, keep it short, so that it is not prone to any injury or trauma, and not to share that.
Right. Doctor, you
Okay.
mentioned clothes, ironing your clothes. Just tell us if sun drying clothes is important, because I have met a lot of people who has a tendency of not drying their clothes in the sun. Is it important?
So yes, if you are a person who has a fungal infection, ideally that is the best, because it's a
Right.
natural sterilization because of the UV rays that are there in the sun. The organisms are naturally killed. Okay, so this is one of the most
Right.
convenient and easily accessible way to achieve that. Okay, but if
Right.
due to any circumstances you're not able to achieve that, then maybe just we
Hmm.
have to ensure that the moisture from the fabric is gone, especially for the patient himself, because the more wet and moist the clothing is, and the sweat is getting trapped, the more it will become a longer cycle for us to treat it.
Right. Doctor,
Yeah.
also tell us what is the difference between fungal infection and bacterial infection? There seems to be a slight thin line between both, and mostly
Yes.
people tend to confuse both the kind of infection. Please enlighten us about it.
Just a second. Can you hear me there?
Yes, we can.
1 second. Hello? Yeah.
Yes, ma'am.
Yeah. So, see, they're totally different things. Okay. Bacteria. So, when we talk about the classification of the living organisms, okay, there are plants, there are animals, and there is fungi. So, fungi is neither belonging to the plant category, nor is it belonging to the animal category. It's a different living entity altogether. And fungus is present all around us. There are millions of species of fungus, but there are only a few hundreds or thousands which are causing infection in individuals. In fact, if you talk about the yeast which is used in baking very commonly, is also a kind of a fungus. Okay, or if you're talking about the mushrooms that we eat, are also a kind of an edible fungus. So we are not saying that all fungi is bad. Likewise, not all bacteria are bad. There are some good
Right.
bacteria which are living in our gut. Okay, so
Hmm.
there are, all the living organisms could be either good or non-pathogenic, and the ones which have a propensity to cause infection, they are the pathogenic ones. Now,
Hmm.
bacteria is a different category of living organisms. Fungus is different. Now, the fungal infections usually on the skin are superficial. So let me tell you a little more technical points about the differences. The fungi will
Right.
always thrive on the dead skin tissue. So the keratin, which is there, the upper dead skin layer, which is rich in keratin, the fungus usually grows on that. So the commonest fungal infection or the ringworm is superficial. It is not posing any harm to your internal organs, very frankly. And that's for the same reason sometimes people are living with it for so long and they are not bothered to treat it, because they know that it doesn't affect their day-to-day lives. The
Right.
bacterial infection is something which causes more symptoms. So whenever you will have a bacterial infection like a boil or a folliculitis, we call it, so that will be
Hmm.
more pain, there is pus discharge, there is more swelling, so it's usually more symptomatic. So in case of bacterial infections, people, for the skin, people will usually contact the doctor because they are developing symptoms, they are uncomfortable, they reach out
Hmm.
earlier. Vis-a-vis in
Hmm.
fungal infections, when sometimes the symptoms are mild itching and they are kind of good to go, they are prolonging it, they are not treating it. The treatment of bacterial infection, in fact, is kind of easier, because the antibiotics which are used for bacterial infections are usually given for a shorter time,
Hmm.
versus the fungal infections, the antifungals, which we give to kill the fungus. Nowadays, in a current scenario where there's so much of resistance seen to the conventional medicines, the course of treatment is a little longer. Okay,
Hmm.
so we are looking at probably like a month or a 2 month course of treatment when it comes to fungal infections, versus a bacterial infection where the patient also is contacting the doctor earlier. So it is caught earlier and treated maybe within a week, 10 days, and it's usually gone. This I'm talking
Right.
about the conventional, the normal bacterial and fungal
Right.
infections. There are different kinds of bacterial and fungal infections which are more severe in nature and which affects the
Right.
internal organs, but I
Hmm.
am not speaking about that. We are talking about the common ones which we see on the skin in day-to-day life.
Right. So, prolonging fungal infection, what can be the worst case scenario of it?
So the worst case scenario is they are spreading it to the people around them. Number one, okay. Number
Mhm.
two, the surface area involvement is so large, then it becomes a challenge for the doctor to treat them. It increases the cost of the treatment for the patient because then they are buying more products. The treatment duration is longer because
Mm-hmm.
the fungal load is so high that we are giving them maybe multiple medicines, not a single medicine, but a combination of two to three different molecules, and that too for a
Right.
longer period of time. So
Mm-hmm.
this it makes the treatment a little prolonged and complicated in that manner. Secondly, many a times there's a higher chance of relapse. So what happens is when the patient is clinically cured, but then sometimes over a period of few weeks or months, they are again getting the infection out of nowhere.
Mm-hmm.
So the
Right.
more extensive the infection is, then it's usually a longer course that you're following and you're looking at.
Right, right. Doctor, are there any environmental factors that increase the risk of fungal infections, and how can individuals mitigate these risks?
Yeah, so of course, heat, as I said, so it's the climate, the weather. So when you're talking about the summer season and the rainy season, so hot and humid environment. Now, people who have an occupational exposure because of the nature of their work, so maybe they are more on the field, or maybe people who are working under hot climatic environment. So that is one. The housewives who are there in the kitchen and they are sweating more profusely. So these are the weather is number one. And number two, again, the environmental factors, I'll also include the topical steroid cream. So a lot of people who are abusing, misusing the steroid creams. So this is also like an external factor which is causing that. So these are the people, who will always be more prone to getting such a thing.
Right, right. So, doctor, are there any dietary or lifestyle habits that one can, use to boost their immunity system or reduce the likelihood of fungal infection?
Yes, so very frankly, diet doesn't have a very major role here, but whatever is generally considered a healthy, nutritious diet is what one can follow. Because the infection is never so severe that it is, maybe life-threatening or maybe, causing like a severe morbidity or mortality in an individual. But yes, it's more about the practices, I believe, rather than the diet. So again, the same thing, clean clothes, good hygiene, maintaining your personal products, not using any particular, like if you're going to a public place, ensuring that you are either wearing a flip flop in the gym or in a sauna, in a swimming pool area. So all those things where you're preventing contamination and you're going to a public place where there are these toilets. Now people are having fungal infection on the buttock area, and then so these are the common places. Ideally, I would suggest that if you want to avoid doing that, or maybe many a times we clean it with a sanitizer, the toilet seats, or maybe the appliances, if you want to follow those practices and carry your own things. Even many a times, say if you're traveling in a train, so your own linens, if you want to carry your own bed sheet, or if you're going to like a place where you don't know who has used a particular thing which then is being offered to you, if you're unsure of that, I suggest use your own things. And if any member in the family is having an infection, I suggest get them treated proactively, because then it's always a source of infection for the others.
Right, right.
Yeah.
Doctor, what about healthcare professionals? How can they, take preventive measures to risk the uh, spread of fungal infection?
So, see, very frankly, I'll tell you about a little bit about the transmission. So, how it is transmitted. One is direct skin to skin contact. So, if a person having at the infected skin, if somebody is directly coming in contact with that, then there is a chance that you may get it. Or number two is through fomites. Fomites means through these inanimate objects that are coming in contact with the infected skin, and then it's coming in contact with a different person. Usually, for healthcare professionals, for us, these infections are not a very common to spread, because
Mm.
we will obviously are we all are very careful, like even in our private practice when we are seeing the patients, we follow a certain standard guidelines wherein we know how to not touch the skin or the affected skin, and then we keep washing our hands and we sterilize our
Right.
hands. So it's usually that, um, in a hospital setup, otherwise, I don't see this as a very major concern in healthcare professionals. No, it's not airborne. See, in healthcare professionals, you're more worried about different kinds of infections which are more airborne, which a patient has
Mm.
released the bacteria or maybe the organism in the air and everybody is breathing that. But this is something which is skin to skin, or like a skin to an inanimate object to the other person's skin. So the risk in healthcare professionals isn't major. Like, according to me, it's easily avoidable.
Right. Doctor, are there any advancement in preventive therapies or vaccines for common fungal infection that our individuals should be aware of?
No, not so. Very frankly, the fungus behaves very different than a virus. See, the virus is a different organism. The bacteria is a different organism, and a fungus is a very different organism. Okay, vaccines are not a thing right now for fungal infections, because there are easier treatment options also available in the form of oral medicines and topical creams, and also no, I have personally never heard or given a vaccine for a fungal infection. No, I think, it's the treatment, though whenever we start treating the patient, I always emphasize on the compliance factor for them. Because for me, I will tell them 5 times, don't drop taking this medicine. You have to not skip this medicine. Take it properly for 1 month. Even if the
Mm.
rash looks to be clinically gone in 15 days, you still continue the treatment till the time I have asked you to do it. And I always tell them that come and meet me for a follow up. Don't stop it without meeting me. I will look at the skin and I will decide if I need to continue this for any longer, or if we are then just maintaining with the creams. So I always spend a little extra time in counseling my patients, because see, very frankly, there are a lot of wonderful medicines to treat this. The problem is not
Mm-hmm.
that we are short of treatment options. We have great deal of medicines, oral tablets, topical creams, and newer and better formulas are coming in the market. The problem is the misdiagnosis, the self treatment which the people they do, and the inadequate treatment that they do.
Right.
Okay, so when we are talking about vaccines, we are talking more about, like a viral infection, where we know that there are no specific treatment programs which will work towards them. So then we are
Mm-hmm.
working more preventive towards there. Here, preventive again is something which, is more of a lifestyle change, or maybe more of a common practice of hygiene. So
Right.
it's again not a very serious problem, very frankly, but the burden of the problem is such because there are so many people who are affected by it.
Mm-hmm.
So that makes it important in a way. Otherwise, it's not something that the fungal infection on the skin is very detrimental to your internal health or to your life. But yes, of course,
Right.
it affects the quality of life of a lot of people. So there is a lot of psychosocial impact, I would call it, rather than a direct health impact, but a lot of psychosocial or a socio financial impact that it has.
Right. Doctor, what about antifungals? Can long-term usage or consumption of antifungals affect the patient somehow?
No, so depending on the extent of infection. So if it's a single patch, multiple patch, the patient has got the infection for the first time, or they are the ones who are every year getting it. Depending on the clinical analysis, when we meet the patient, we decide the course of treatment. We always prefer to give a combination of oral antifungal along with topical antifungals, because the concept is that we want to give medicines which work by multiple channels. So we know that this is your target. I'm going to hit it by this way, hit it by this way, and hit it by this way. So if I'm attacking it by all three mechanisms or pathways, I'm sure that this is going to get eliminated. So
Right.
this combination could be achieved by giving different category of oral medicines and topical antifungals. Also,
Mm.
the compliance bit, the tips or the care tips that we give to the patients is important, and we closely monitor the duration, and we ensure that the patient doesn't drop the treatment in between abruptly. So I always like to monitor them at a 15-day to a 1 month interval, and I always instruct my patients not to stop till they get to see me. So
Right.
in this way, we have good antifungal treatments, and if done properly, if the treatment is taken properly, it's very easy to get rid of it.
Right. Doctor, vaginal fungal infection. We see a lot of female nowadays suffering from the same issue, and the process is extremely painful. So please enlighten us. How does it take place? How does it look like initially? How does one identify that it is a fungal infection? And whom do we go to when we are suffering, a dermatologist or a gynecologist?
Gynecologist. So this very commonly asked question again, and you'll be amazed to know that most of the people have this doubt that who is the correct specialty of doctors to go
Right.
to. So let me tell you, when we study dermatology in India as a part of the curriculum, we are experts in skin, nail, hair, and mucosa. Your mucosa includes your oral mucosa and the genital mucosa. A dermatologist
Right.
is also an STI specialist. So we are also trained to handle and understand sexually transmittable diseases and leprosy. So this
Mm.
is the core curriculum, which, as per the guidelines of our medical institutes, is what a dermatologist is trained to study. So of
Mm.
course we are one of the justified doctors who are trained to treat it. However, because a lot of women think that it is a problem related to the genitals, so they usually go to the gynacs, and gynecologists are also, because they see so many cases, of course they have a sound knowledge of treating this
Right.
too. So there could be an overlap. They could either go to a gynecologist or they can reach a dermatologist. The
Mm.
common likelihood is for a patient to go to gynacs, which is okay as far as the treatment course is followed in the best possible manner. They can visit anybody. Now, when I'll tell you the common symptoms related with vaginal candidiasis. So it's called as candida infection.
Mm.
Or vaginal candidiasis, or the vaginal fungal infection. So the candida is a yeast. It's a kind of a fungus. It is commonly normally present in the mucosa, in the vaginal mucosa. It is normal and
Right.
it is not dangerous to have that. But the problem is when it multiplies more than the normal concentration is when it becomes
Mm.
pathogenic. So
Mm-hmm.
these are common cells, we say, which are normally living on our body, harmless. In fact, they are good for the cells of the body and good for our health. But when they multiply over and above the capacity is when they start causing a problem. Now, this could happen when a person is taking multiple courses of antibiotics and your healthy bacteria are dying. So then the other organisms are multiplying, in order to compensate for that. So a lot of antibiotics somebody is taking on and off, or if a person again is diabetic where the immunity is low, or if a person has other causes of suppressed immunity like chemotherapy cases, cancer patients, patients who are on immunosuppressant medication. So these are the common group of people. However, a healthy individual, again saying, can develop candida infection. Also, many times it is sexually transmittable. So if the partner has a candida infection, then they can also transfer it to the other partner and vice versa. Now, the common signs in females, what I see is they complain of itching and they complain of a discharge. Now, the discharge is very typical. It's a curdy white discharge, classically, that we call it as. And I always ask my patients if they notice a curdy white discharge, or when we do an examination, usually we can see the discharge. The itching is variable. Some people may have mild itching, but most of the people have an uncomfortable level of itching. And that
Mm.
is what brings them to the doctor. Again, the treatment is simple. So correct diagnosis and starting the treatment at a correct time and following the proper course of treatment is what helps the best.
Right, right. Very, very informative, doctor.
And
The Now we'll quickly go through the questions which are coming from our viewers. The first question
right.
comes from Chandni Sharma, who asks, "Are there any food that can help fight fungal infection?"
Very frankly, there are no specific foods, as I said, but following a healthy, balanced nutrition is what one should look at. Again, when we are talking about immunity, we are talking about specific immunocompromised conditions. If you are a person who doesn't have that, and if you have like a basic good nutrition, your immune status is good. I think that is good enough. More than in the food aspect, I would again emphasize more on the hygiene aspect here. Okay, and more on the awareness rather than food. But of course, yes, consume all the healthy, balanced diet which ensures that you have a decent immunity.
Right. The next question, doctor, comes from Alia. Alia asks, "Doctor, is using moisturizer help to heal fungal infection along with fungal cream?"
Yes, so many a times when we are talking about the fungal infection, as I said, it lives on the dead skin layer of your dead layers of the skin. Many a times the barrier is broken. So there is a natural barrier layer which is there on our skin, and many a times that is broken. So if you're moisturizing the skin well, then of course it helps. It helps clear the infection faster. Secondly, also the moisturizing will give you symptomatic relief. Symptomatic relief meaning you'll feel comfortable, bleaching may be lesser. So you don't have to stop using a moisturizer, rather you can continue using a moisturizer.
Doctor, what about application of makeup? Is it fine if the patients do that?
Yeah, so on the face, very frankly, if somebody has a fungal infection on the face, I would say not to do it because, then with the product, with your brushes, then you're spreading it, you're contaminating the makeup. And I would even suggest somebody else to not use the same products. Ideally, avoid. But if somebody has a fungal infection on the rest of the body and the face is spared, go ahead. I don't see a problem there.
Right. Doctor, the next question comes from Sony who asks, Doctor, can I have one question? Can wearing tight clothing cause
Yes, yes.
infection?
Very important. I missed mentioning this. So again, the frictional component, as we discussed. So whenever the skin is tightly rubbing against the skin fold, or maybe it is against a fabric, then of course that plus the heat and the sweat is trapped. So the tight clothing will definitely aggravate that. So you have to ideally always, I tell my patients to wear comfortable clothes, maybe cotton or linen, loose, airy, breathable kind of fabrics, which will be the best. Again, the
Right.
gym, I tell a lot of patients about the gym clothes. So I tell them that don't wear those ultra tight shorts or, very
Mm.
body fitted gym wear whenever you are having an infection. Wear more comfortable clothes and always take a shower post, and always never repeat wear the clothes, even if you have worn it for, say, half an hour without washing it, not to wear it if you already have infection.
So doctor, working out, having daily routine exercise is fine. Are we okay with that?
It is okay. So in patients in whom the infection is very stubborn and very extensive, and sometimes they get very uncomfortable with the sweat, I tell them not to do it. But if a person has an isolated infection elsewhere, like a one or a two patch, say on the arm or on the leg or in the hands, it's okay. But if it is a very extensive body fold involvement, and if going to the gym, the clothing and the sweating is not allowing it to heal, then I tell them to give it a break for some time.
Right. The main thing is you have to visit your expert. Do not go for self medication. We always suggest our patient. Our experts are always there to help you out. Please, whenever you see any changes in your body, visit your nearest expert. The last question, doctor, comes from Ankita, who asks, "Ma'am, क्या essential oils fungal infection में help करते हैं?"
See, essential oils, very frankly, this works as a moisturizer, है ना? So, ये oils हो गए, creams हो गए, ये सब एक moisturizer की तरह हम उसको, we look at it in the category of a moisturizer. So again, as I said, if your barrier function is good, then you'll be better off. But I would not say कि essential oil से वो ठीक हो जाएगा. Okay? So
Right.
you can use it. It may help, but आप उस पे rely नहीं कर सकते हो कि उससे वो चला जाएगा. You need specific creams if you have a proper patch that is developed. Okay?
Right. Right. Before we take a leave, doctor, any take-home message for our viewers who has watched us so far?
Yes, I would like to use this opportunity to again bring the awareness against topical steroidal creams. And there is, I call it as a cocktail or a khichdi cream, which is available in the market, which has a steroid, an antifungal, an antibacterial, and this is very commonly available in India over the counters, and a lot of doctors or a lot of practitioners who are non-doctors, they lack the knowledge about the composition. They are just prescribing it, and a lot of people are, amongst friends, are telling them, I use this, you use this. So these kind of creams have worsened or have made it so challenging for us dermats to treat fungal infection, because at the first site of the infection, people first try all these measures, and once it gets a little difficult to cure is when they reach the doctor. But by that time the cream has done such a damage that then it becomes challenging for us And this is also causing a community level resistance to these important medications, because the half treated cases or incorrectly treated cases, the fungus has become resistant, and now it's not responding even to the common medicines, the important medicines. So I would suggest that don't randomly buy any cream which your pharmacist has said or which your friend has said. Always meet your doctor and use a proper cream, because I see steroid creams used left, right, and center amongst most of the people and most of the households. So please be very careful. I tell my patients why how you don't pop an unknown medicine without getting it checked. You have to follow the same principle for the products which you're putting on the skin, because this is affecting your skin. Skin is your largest organ of the body, and many a times also there is a systemic absorption of certain drugs. So it's crucial, it's important. So be mindful of what you're using, and in case of any doubt, please meet your doctors.
Right, right. Well, that was Dr. Siddhi Tiwari for us. Thank you so much, doctor, for your valuable time. We
Thank
had
you
a
so
wonderful session
much.
today,
Thank
and it
you.
was very, very informative for our viewers. And it was great to hear from you. We look forward to many more such sessions in coming time. Also, viewers, thank you so much for your excellent participation. For more updates, stay connected to our channel, and do not forget to subscribe to channel Radiance with You. Thank you so much. Stay safe and stay healthy.
Thank you so much, everyone. Thank you. Good night. Bye.